Okay, go.
So I've already grabbed my medication from the Pyxis and compared it to the doctor's order. So I'm now going to do my first check comparing this to the MAR. So this is for Emma-Wrightson. I have cloxacillin. I need to give 750 milligrams, and this is 2 grams. So I know that I can grab my dose from this. It is an IV medication, and this can be given IV. And it's given Q4H, and this is the correct time of day to be giving it for her. I'm also noting that the integrity of the vial is good, and it is not expired. I'm also noting that she has no known allergies, so I have nothing to worry about with this medication. I'm going to then look at my drug monograph, and I'm noting I can give this as a student nurse. The usual dose is 1 to 2 grams, and mine is much below that, so that is okay. I'm going to be noting that I have the 2 gram vial, so I'm going to be reconstituting with 6.8 mLs of sterile water, and that's going to give me a final volume of 8 mLs and a final concentration of 250 milligrams per ml, so I will be drawing up 3 mLs for my mini bag. I'm going to be putting it in a 100 ml mini bag of normal saline and giving it over 60 minutes. So that is good. I'm then also just going to note that there are no hazards that really apply. I will inform her of the potential diarrhea or nausea and watch for any signs of hypersensitivity. So that is all good. I'm then going to wash my hands and begin to draw up my medication. My sterile water, actually. So, this is I'm going to open up my blend fill and grab my 10 ml syringe, making sure to banana peel that back. And I need to be drawing up 6.8 mLs. I'm just going to confirm that, of sterile water. So I'm then going to alcohol swab the top for 30 seconds and let dry for 15. Okay, so since that has been dried, I'm going to inject my air into my medication and draw up my 6.8 mLs.
So, upon entering into the room, I'm going to have
making sure that there are no bubbles so that the drug is reconstituted properly.
So, hi, Mr. Watson. My name is Ms. Mendoza. I'm going to be your student nurse today. I'm just here to
And then I'm going to
zip through. I'm just going to take a look at your armband here. So,
and then I'm going to get my final.
Do you have any more allergies? Okay, give me a moment. I'm just going to check my volume again. So now doing my third check. So for
and recapping sterilely.
Which is 4 ml.
I'm just going to make sure that it's right at that age and that there are no bubbles.
And this is the Minibag daily, and the time to give it is now. So now I'm just going to check my primary. So my primary is currently running as normal saline, which is compatible
There we go.
with my medication.
I still have my 6.8.
Running at the correct rate, and it seems
Okay, so then at this point I can grab my medication. I'm going to swab the top again for 30 seconds, letting dry for 15. And then I'm going to instill my sterile water and letting the air come out as needed to maintain a pressurized vial.
This is your zithromax. We're going to be using this for your cellulitis.
Okay, so then I'm going to recap that
What
again.
we'll be doing,
And I'm going to gently rotate this in my hand, ensuring that all of the powder is reconstituted and that there's no sediment, as well not adding new air bubbles by rolling too vigorously. So everything is reconstituted and that is all good. So now that I have a final volume of 8 mLs, I am going to be drawing up my 3 mLs that I need to get my dose of 750. So I am going to get my air set to 3. I'm going to swab the top of the vial for 30 seconds, let dry for 15. And I'm going to inject my air and draw back my required dose.
I'm going to take out my tubing and noting that my tubing is still sterile and both caps are on. I'm going to clamp my tubing to ensure that no medication runs out.
Get rid of any bubbles so that my patient is getting their complete full
And
dose.
I'm going
making sure not to touch any of the blunt fill so that that remains sterile.
Becky in terms of maintaining sterility at this point. Okay, so now that that's done.
So that is good. So I'm going to
I am going to take an alcohol swab and wipe the port that is above the pump because this needs to be regulated by the pump.
set that to my 3
30
mLs.
seconds, allowing it to dry and to feed.
That is good.
Okay.
I'm going to
Hold on
recap,
that, ensuring to keep it sterile.
and I have my 3 mLs.
Attach.
Okay, so now that I have my 3 mLs, I'm going to do my second check as well as make my label. So this drug is for Emma Wrightson. My drug name is cloxacillin. My dose is 750 milligrams. My volume is 3 mLs. My dilutant is going to be my 100 mLs of normal saline. And then my final volume, once I have my concentration that I've now made in there is going to be my 750 divided by my final volume, which is going to be 103 mLs. So my final concentration is going to be 7.28 milligrams per ml. And it is October 17th, 19, and I'm going to sign it UMSN3. Okay, so now I'm going to do that second check. So I'm comparing my vial to my label, to my medication, to my MAR. So this is for Emma Wrightson. I have cloxacillin, which is what I have here, cloxacillin. I need 750 milligrams. So since this was 2 grams, I needed 3 mLs, which is what I have here. So that is good. I do have my correct dose, which is 750 milligrams. This is an IV medication, and this can be given IV, and it'll be put into a mini bag, and this is the correct time of day to be giving it, as it's Q4H. So that is good. So I'm going to set this with my syringe, and I'm going to begin to instill it into my mini bag. I chose a 100 ml mini bag as my patient is new to this medication, and I'm going to instill it over 60 minutes just to ensure that it does not harm her veins, as it is newer for her, and we don't want to cause a reaction. So I'm going to draw that for 30 seconds, let dry for 15, making sure to keep it sterile. I've also noted the integrity of the bag is good and it's not punctured or leaking. When I instill my blunt fill, I'm going to make sure that I'm not puncturing the side at all, and this mini bag is not expired. I'm going to remove my blunt fill. I would not recap, this would just go right into the sharps. And I'm going to gently rotate my mini bag to make sure that the medications mix. I'm going to place my label on my mini bag. And that's good, and I'm going to collect my supplies that I need to go into the patient's room. So I have my secondary tubing, my label for my tubing, I have my mini bag, and my MAR. So that's good. I'm going to wash my hands before going into the patient's room, and I'm going to do my initial safety check, making sure that the bed is in the lowest position and my patient isn't in any current distress. Hi, my name is Brianne Johnston. I'm going to be your student nurse today. I just have your antibiotic here to give you, but before we begin, can I just get a look at your armband there? Can you tell me your name? Emma Wrightson. And do you have any allergies? No allergies. That's great. So before we begin, I'm going to do my third check, and then I'll be right with you. So I'm doing my final check. So this is for Emma Wrightson, which I did just confirm with her armband. I have cloxacillin. This is 750 milligrams, as I put my 3 mLs in here. This is an IV medication, as it is in an IV mini bag, and this is the right time of day to be giving it. So that is all good. So Emma, I have your cloxacillin here. This is an antibiotic helping with that infection of your arm from your cat scratch. Some side effects you may be experiencing are some nausea, vomiting, or diarrhea. If you do, just let us know. As well as we are going to continue to monitor for any signs of hypersensitivity. I'm then going to look at her IV just to make sure that it is running patently. There's no erythema, redness. Are you having any pain at the site at all? No, it's all looking good. It is not clamped. That's not clamped. Everything is good. It is running at the correct rate, which it should be set at. And this is normal saline, which is compatible with my mini bag. So that is all good. So next I'm going to also note that this is not labeled, so if it weren't, I would find out when it was last hung, and if I could not find out, I would hang a new primary, as I do not know when this was hung up. I'm going to open up my secondary tubing and lower my primary, which is good. Noting that there are caps. I would get new secondary tubing because there is no cap, but for demo purposes, I'm going to pretend that there was a cap on this end. So I am going to, at this point, spike my Minibag, making sure to keep both ports sterile. That is good. And before I invert it, I'm going to make sure it is clamped, which it is, so that's great. I'm going to hang this up on my line while I attach it to the port. So then I'm going to grab my alcohol swab, and I'm going to be swabbing the port upward of the Baxter pump to ensure that the rate is being controlled and I'm not just giving my patient this uncontrolled medication. I'm doing this for 30 seconds, letting dry for 15. I would at this point remove the cap from the end and attach. So that is good. This is still clamped. So at this point, I am going to invert my medication lower, unclamp to make sure that it's being back primed. I'm watching to make sure that the bubbles are going through and that my chamber will be filling up to 50%. I am going to 1/3 full, sorry. Since there's a little excess, I am just going to pump that back up as my medication is now clamped. So for Watson Williams, born on June 14, 1983, okay, so that's good. I'm going to hang that up and I'm going to go into my secondary. So the rate, as I'm doing this over 60 minutes, I need to be infusing my entire volume, which is 103 mLs. So my rate is going to be 103 mLs per hour. My volume to be infused is 103 mLs. I do not want to be called back because I am going to come back and make sure that the primary has taken over running. So I'm going to confirm my secondary and hit start. I'm watching here to make sure that it is not clamped and that I'm watching for my 3 drops of medication. So I would watch for all 3. And then going to just stay with her for a couple minutes just to make sure that she's not experiencing any immediate reactions of hypersensitivity, and then make sure that I'm coming back in 60 minutes to make sure that this primary has started over and that the secondary is no longer running. I am going to do my exit safety check, making sure that she has the call bell, that she's comfortable, and again reminding her of those side effects to be watching for. And I'm also going to label my tubing before I leave with the date, time, and my initials that it was hung. And I know that everything is unclamped. My primary is unclamped, that's all unclamped. We are good to go. So I'm gonna exit the room and sign my MAR that I gave it, the time, my initials, and then the UM SN3, a designation.